In this series of lessons, we will look at the joints, or the articulations, which are the structures that unite the bones of the skeleton, as well as give the skeleton mobility. The image here is showing two artificial joints, an artificial hip joint on the left, and an artificial shoulder joint on the right. The joints, or the articulations, are described as sites where adjacent bones are united, or where bone and cartilage are united. Generally speaking, the joints are the weakest parts of the skeleton because they are places where bones are united by non-bony materials, and because they are not one-piece structures. So often they are composed of many pieces that are connected together, and where they are connected together represents points where they could fail or where they could become damaged. The joints have two functions. The first is that they unite the bones, and the second is that they provide mobility to the skeleton. And we'll see that this mobility is quite variable, from joints that are immovable to joints that are freely movable. The joints can be classified in two ways. The first is structurally, and the second is functionally. The structural classifications of joints categorize the joints by the type of materials that unites the bones. The functional classifications categorize the joints by the amount of movement that the joint is capable of producing. The structural classifications are much simpler than the functional classifications, so we will primarily focus on the structural classifications. I do want you to be familiar with the names of the functional classifications, be able to define those functional classifications, as well as give some specific examples. There are 3 structural classifications of joints, as well as 3 functional classifications. So we'll begin with the functional classifications of joints. So as mentioned previously, the functional classifications of joints describe the degree of movement that particular joint is capable of producing. I like to think of these classifications or the functional classifications, as 2 ends on a continuum, ranging from immovable on one side of the continuum to slightly movable in the middle, and then freely movable joints on the opposite end. So at one end of this continuum are the synarthrosis joints. These are the joints that are immobile but are the most stable. They function to hold the bones tightly together so that they can protect internal organs. Amphiarthroses are joints that have some limited mobility. So examples of amphiarthroses are the pubic symphysis, as well as the intervertebral discs in the vertebral column. At the other end of the continuum are the diarthroses. These joints are freely movable and give a very wide range of motion. Many of the joints of the upper and lower limbs are diarthrosis joints, and they provide very excellent mobility to these body parts. However, because of their excellent mobility, these joints tend to be the least stable and are frequently damaged, at least in the case of when joints become damaged. So recall that there are 3 structural classifications of joints. We'll begin with the fibrous joints. These are the joints in which adjacent bones are united by fibrous connective tissues. For example, the sutures that are found between the cranial bones and the broad ligaments that are found between bones like the radius and the ulna are examples of fibrous joints. The next type of structural classification is the cartilaginous joints. And these joints are formed from either hyaline cartilage or fibrocartilage. The hyaline cartilage joints are called synchondroses and include things like the epiphyseal plates found in the long bones, as well as the joints between things like the sternum and the ribs. The fibrocartilage joints are called the symphyses and include the intervertebral discs and the pubic symphysis. The third and final structural classification of joint is the synovial joint. At this type of joint, the articulating surfaces of the 2 bones are not directly connected. Instead, they simply slide or glide across one another within a joint cavity. The joint cavity, which is called the synovial joint, is filled with a slippery, lubricating fluid that's called synovial fluid. We see that the exterior of the joint is composed of a dense, irregular connective tissue joint capsule, along with some reinforcing ligaments. The synovial membrane that lines the inside of the capsule is the structure that produces the synovial fluid. These types of joints allow for the greatest movement between the bones. And synovial joints are the most common structural type of joint in the body. All of these synovial joints are diarthroses because they are freely movable joints.